not well rehearsed. Anyway, I'm Phil Tompkins. I'm currently serving as the president of the Newburgh Health Foundation. But before I make a few more comments, I just wanted to be sure and recognize Alan here. Alan was on the board for many, many years. He was there when I came. Taught me a lot, and he retired and wanted to step back. He retired from ADAC, wanted more time to do traveling, and then we got him to volunteer to the MC here. So he's right back into the game in his second year. I'd like to give Alan a little recognition. I came on the board 5-6 years ago, and I've really enjoyed the opportunity to serve on this board, a community that has provided services for me and for my family for over 35 years. I have 4 kids, and at some point I think that I personally financed the emergency room myself. My kids in there. Tremendous help on that. I feel deep compassion for this and tremendous respect for this organization and for what they have done. I also believe steadfastly in the mission of Providence Hospital, the mission of caring for the poor and the vulnerable through excellent health care. It's hard to believe that time moves quickly. In just 1 week, next week on June 6th, it will be the 5th anniversary of our brand new hospital here in Newburgh. And how fortunate we were, and thank the sisters for supporting and getting that hospital built when we did. You know, really difficult humanities. I also learned so much about the excellent service provider for Newburgh Hospital. I gained a greater understanding of the challenges faced by other healthcare delivery systems in today's ever-changing environment. Those changes include providing excellence in education and training for our top-notch health care providers, such as those you just heard about today. The technology is moving rapidly, and it's hard to stay up with all of those technologies. We also want to continue to provide the best health care we can right here in Newburgh, so you do not have to leave town. As a foundation leader, I have personally given both in time and resources to the Providence Newburgh system. I believe in it that much. So today we're asking each of you to join me in a gift or a commitment to make a gift to the foundation so we can continue on with our work. Together, your acts of generosity provide support for this essential educational fund that hurt so many over the years. On behalf of the Foundation Board, Trustees, and the leadership of Providence Newburgh Health Center, I thank you for your thoughts and your important ideas. Thank you.
Phil, one of the advantages of serving on the foundation board is to get some insight, if you will, into the hospital and its people, and it's a very rewarding experience. Now, I told you I was going to interrupt you because of people up here in the platform. I didn't tell you I was going to interrupt you because of all the clapping, but since you know, you put your forks down, if you would pick up the envelope and take a moment and consider a gift to Providence Newburgh Health Foundation to fund scholarships like the ones received by Trish, Joey, and Derek, and all the other scholarship recipients over the past 10 years. Cards and envelopes are on your table. There's only one size envelope this year, so I couldn't get confused. So remember, large donations go in the envelope. Not sure where the small ones go, but they're just as welcome. As you fill out your check or card, think back to the last time you received health care from a provider. Perhaps you thought, as I have done on occasion, is this person current in their area of health care? Consider, if you will, as you're filling out the card, that the recipients of the scholarships that you provide now may very well be the health providers treating you next time. Please.